Hello, thank you for taking the time to watch this video about the safety and dosing administration data from the pivotal trials for NOURIANZ, istradefylline. I'm Dr. Jill Marie Giordano-Farmer, an assistant professor of neurology and the director of the Parkinson's Disease and Movement Disorder Program at Global Neurosciences Institute. This program is sponsored by Kyowa Kirin Inc., and I am a paid speaker presenting on behalf of Kyowa Kirin. NOURIANZ is an adenosine receptor antagonist indicated as adjunctive treatment to levodopa-carbidopa in adult patients with Parkinson's disease experiencing OFF episodes. In addition to reviewing the NOURIANZ safety data from the pivotal trials, I'll be highlighting the important safety information throughout the presentation, and we'll start with some of the warnings and precautions. Dyskinesia. NOURIANZ, in combination with levodopa, may cause dyskinesia or exacerbate pre-existing dyskinesia. In clinical trials, 1% of patients treated with either NOURIANZ 20 mg or 40 mg discontinued treatment because of dyskinesia, compared to 0% for placebo. Hallucination psychotic behavior. Because of the potential risk of exacerbating psychosis, patients with a major psychotic disorder should not be treated with NOURIANZ. Consider dosage reduction or discontinuation if a patient develops hallucinations or psychotic behaviors while taking NOURIANZ. Impulse control, compulsive behaviors. Patients treated with NOURIANZ and one or more medications for the treatment of Parkinson's disease, including levodopa, may experience intense urges to gamble, increased sexual urges, intense urges to spend money, binge, or compulsive eating, and/or other intense urges, and the inability to control these urges. In clinical trials, one patient treated with NOURIANZ 40 mg was reported to have impulse control disorder, compared to no patient on NOURIANZ 20 mg or placebo. As part of the clinical development program, 4 pivotal clinical trials were conducted to evaluate the efficacy and safety of NOURIANZ for the management of OFF episodes in PD. Study 1 was conducted in the US and Canada. Study 2 was conducted only in the US. Studies 3 and 4 were conducted in Japan. Of the patient population exposed to NOURIANZ, 50% were male, 32% were white, 67% Asian, and the mean age was 65 years. The range was 33 to 84 years. Of these patients, 356 received NOURIANZ 20 mg and 378 received NOURIANZ 40 mg. The safety of NOURIANZ was evaluated in 734 patients, with PD taking a stable dose of levodopa-carbidopa for the duration of the studies, with or without other PD medications. In the 2 trials conducted in Japan, however, patients could have received levodopa benzerazide instead. Concomitant use of medications for PD was allowed, and across all 4 trials, 85% were on dopamine agonists, 40% were on MAOB inhibitors, 38% were on COMT inhibitors, 33% were taking amantadine, and 13% were taking anticholinergics. The adverse events that were observed in 2% or more of patients treated with NOURIANZ and greater than placebo are shown here. Dyskinesia had the highest rate and occurred at about twice the rate of placebo. The incidence was 15% for NOURIANZ 20 mg, 17% for NOURIANZ 40 mg, and 8% for placebo, in combination with levodopa. The most common adverse reactions, in which the frequency for NOURIANZ was at least 5% and greater than the incidence on placebo, were dyskinesia, dizziness, constipation, nausea, hallucination, and insomnia. Because clinical trials are conducted under widely varying conditions, adverse reaction rates observed in the clinical trials of a drug cannot be directly compared to rates in the clinical trials of another drug and may not reflect the rates observed in practice. Discontinuations due to adverse reactions were similar to placebo. About 5% of placebo patients discontinued versus 5% of 20 mg NOURIANZ patients and 6% of 40 mg NOURIANZ patients. The most frequently reported adverse reaction causing study discontinuation was dyskinesia. 1% of patients treated with either NOURIANZ 20 mg or 40 mg discontinued treatment due to dyskinesia, compared with 0% on placebo. Similarly, 1% of patients treated with NOURIANZ 40 mg discontinued due to hallucinations, compared with 0% receiving placebo or NOURIANZ 20 mg. Now, let's look at treatment-emergent adverse reactions of special interest. The rate of falls in the placebo group was 9.4% and 6.5% and 6.9% with NOURIANZ 20 mg and 40 mg respectively. The rates of nausea and vomiting were similar in the placebo and NOURIANZ 20 mg groups at 4.7% and 4.8% respectively, and 6.9% with NOURIANZ 40 mg. Impulse control disorders were seen in 0.3% of patients on NOURIANZ 40 mg, compared with none in patients administered NOURIANZ 20 mg or placebo. Now, let's discuss the dosing recommendations for NOURIANZ. The recommended dosage of NOURIANZ is 20 mg orally once daily and may be increased to a maximum of 40 mg once daily, which may be taken with or without food. Since NOURIANZ is metabolized by CYP3A4, the maximum recommended dosage of NOURIANZ in combination with a strong CYP3A4 inhibitor is 20 mg once daily. In fact, NOURIANZ use should be avoided with strong CYP3A4 inducers. It may increase CYP3A4 substrate exposure at the 40 mg dose. You should also monitor for adverse reactions when administering drugs that are P-glycoprotein substrates. Dose adjustments with NOURIANZ are recommended when managing special populations and are summarized here. In the NOURIANZ clinical trials, 53% of patients were greater than or equal to 65 years, and 13% were greater than or equal to 75 years. There were no differences in effectiveness in these patients compared to those who were younger. Therefore, there is no recommended dose adjustment of NOURIANZ based on age. Just to note, the safety and effectiveness in pediatric patients have not been established. In patients with moderate hepatic impairment with a Child-Pugh B score, the maximum recommended dosage of NOURIANZ is 20 mg once daily. Patients with moderate hepatic impairment should be closely monitored for adverse reactions when using NOURIANZ. The use of NOURIANZ in patients with severe hepatic impairment based on a Child-Pugh C score should be avoided. No dosage adjustment is required for patients with mild, moderate, or severe renal impairment. NOURIANZ has not been evaluated in patients with end-stage renal disease, ESRD. Based on drug-drug interactions for patients taking CYP3A4 inhibitors and inducers, P-glycoprotein substrates, and for those who smoke 20 or more cigarettes per day or use the equivalent amount of another tobacco product, the recommended dosage of NOURIANZ is 40 mg once daily. Some additional important safety information related to special populations and overall adverse reactions observed in the pivotal trials is seen here and are as follows. Drug interactions. The maximum recommended dosage in patients taking strong CYP3A4 inhibitors is 20 mg once daily. Avoid use of NOURIANZ with strong CYP3A4 inducers. Specific populations. Pregnancy, based on animal data, may cause fetal harm. Hepatic impairment. The maximum recommended dosage of NOURIANZ in patients with moderate hepatic impairment is 20 mg once daily. Avoid use in patients with severe hepatic impairment. Adverse reactions. The most common adverse reactions with an incidence greater than or equal to 5% and occurring more frequently than with placebo were dyskinesia, 15%, 17%, and 8%, dizziness, 3%, 6%, and 4%, constipation, 5%, 6%, and 3%, nausea, 4%, 6%, and 5%, hallucination, 2%, 6%, and 3%, and insomnia, 1%, 6%, and 4% for NOURIANZ 20 mg, 40 mg, and placebo, respectively. You are encouraged to report suspected adverse reactions to Kyowa Kirin Inc. at 1-844-768-3544 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. In summary, in the 4 pivotal trials, there were several adverse events observed at a rate greater than 2% and higher than placebo. In summary, in the 4 pivotal trials, there were several adverse events observed at a rate greater than 2% and higher than placebo. The one with the highest incidence was dyskinesia, which occurred at about twice the rate of placebo, with a slightly higher rate in the 40 mg treated patients. Treatment-emergent adverse reactions of special interest were evaluated, and there was a slight dose-dependent increase compared to placebo. Both the 20 mg and 40 mg doses demonstrated increased rates of orthostatic hypotension and neutropenia. The 40 mg dose demonstrated a slight increase in hallucinations, sleep disturbances, impulse control disorders, nausea, and vomiting. The 20 mg dose was comparable to placebo for these 4 AE categories. The rates of falls in the placebo groups were 9.4% and 6.5% and 6.9% with NOURIANZ 20 mg and 40 mg respectively. Liver enzyme evaluations were observed less frequently in the patients receiving 20 mg and 40 mg NOURIANZ than placebo. Patients included in the trials were on multiple therapies, including other adjunctive therapies for the treatment of PD. The warnings and precautions for NOURIANZ include dyskinesia, hallucinations, psychotic behaviors, and impulse control compulsive behaviors. Patients should be monitored for dyskinesia or exacerbation of existing dyskinesia while on NOURIANZ. If hallucinations, psychotic behaviors, or impulse control compulsive behaviors occur, consider reducing the dose or stopping NOURIANZ. Thank you for taking the time to watch this video, which reviewed the safety data from the pivotal trials for NOURIANZ. For additional information about NOURIANZ, istradefylline, an adenosine A2A receptor antagonist, or to review the efficacy data from these trials in more detail, please see our other videos on these topics. You can also find additional information by visiting the NOURIANZ website for healthcare professionals at www.nourianzhcp.com.